Dear seniors, have you ever been advised to drink guava leaf tea to ease joint pain? But is it truly a good solution for your body, which may be getting weaker with age? In today's video, we will explore a familiar leaf that not many people truly understand, especially its benefits and risks for joint and bone health. According to statistics from the National Institute on Aging in the United States, more than 50% of people over the age of 60 are affected by joint and bone problems, including osteoarthritis, arthritis, and muscle pain. As we age, our joints lose flexibility, cartilage becomes worn down, bones turn brittle, muscles weaken, and daily movements become increasingly difficult. In the search for gentle and natural solutions, many have turned to guava leaf tea, but surprisingly, if not used properly, this seemingly harmless leaf can quietly affect your calcium absorption and gut health in negative ways. Please stay with us until the end of the video to fully understand both the pros and cons of guava leaf tea for your joint health. We will analyze it based on scientific research and practical guidance that is easy to apply, either for yourself or your loved ones. The benefits of guava leaf tea for joint health in older adults. 1. Anti-inflammatory effects and support for joint pain relief. Have you ever noticed that on days when the weather changes, your joints swell, ache, or feel stiff in the morning? This is one of the most common signs of chronic arthritis, which troubles many seniors. While many anti-inflammatory medications can cause side effects if used long-term, nature has also gifted us with gentler alternatives. One of them is guava leaf tea. Guava leaves contain many valuable plant compounds, especially flavonoids and quercetin. These substances have been studied for their natural anti-inflammatory effects, according to a report published in the International Journal of Inflammation. Guava leaf extract has the ability to inhibit inflammation-causing enzymes in the body, such as COX-2. This action is similar to some over-the-counter pain relievers, but is much gentler on the stomach and liver. The way these compounds work is quite interesting. When you drink guava leaf tea, your body absorbs the flavonoids. These flavonoids help reduce the production of inflammatory mediators and soothe the swollen tissues around your joints. As a result, pain in areas like the knees, wrists, ankles, or spine may gradually decrease over time when used regularly and in proper amounts. Some individuals have shared that after drinking guava leaf tea every day for about 2 weeks, their morning joint stiffness noticeably improved. They could get up more easily and no longer felt like they were dragging themselves out of bed. This is a positive sign, showing that when used properly, guava leaf tea can be an effective support alongside a balanced diet and appropriate physical activity. To get the best effects, you should brew the tea using fresh or sun-dried guava leaves, boiled in water for about 10 to 15 minutes to extract the most beneficial compounds. It is best to drink the tea 30 to 60 minutes after breakfast or lunch. Avoid drinking it on an empty stomach or right after taking joint medication. Have you ever tried drinking guava leaf tea to ease joint pain? If so, how did it make you feel? Please share your experience, as your journey may help someone else as well. 2. Antioxidant protection for cartilage tissue. For older adults, one of the silent causes of joint degeneration and bone weakening is the continuous attack of free radicals. These are unstable molecules produced by the body's metabolic processes by consuming unhealthy foods or from exposure to environmental pollution. When the amount of free radicals becomes too high, they begin to destroy healthy cells, including cartilage cells at the ends of your joints. Cartilage acts like a soft cushion between bones, allowing joints to move smoothly without pain. When this cartilage layer is damaged, the bones rub directly against each other, causing pain and stiffness. This is why antioxidants play such a crucial role in joint health. Guava leaves are among the types of leaves that contain high levels of antioxidants, including vitamin C, carotenoids, and especially polyphenols. According to research from Tufts University in the United States, these compounds can slow down the degeneration of tissues, protect cartilage cells from free radical damage, and support the regeneration of connective tissues around the joints. In addition, the vitamin C found in guava leaves plays a direct role in collagen synthesis. Collagen is a type of protein essential for maintaining the elasticity and flexibility of cartilage and ligaments. For older adults, the body's natural ability to produce collagen significantly decreases. That is why support from antioxidant-rich foods becomes extremely important. Many people have shared that after regularly drinking guava leaf tea along with a diet rich in green vegetables, fresh fruits, and light exercise, they felt their joints became more flexible and less painful when moving. Although not a miracle cure, daily consistency can gradually lead to long-lasting improvements in bone and joint health. When brewing tea, you can combine guava leaves with a few slices of ginger or lemongrass to enhance anti-inflammatory effects, aid digestion, and warm the body. This is especially helpful in the morning or on cold days. Drinking 1 to 2 cups a day, without added sugar, is a gentle, natural, and safe way to support joint health. What do you think about adding antioxidant-rich foods to your daily routine? Besides guava leaves, are there any other natural foods or remedies you are using to protect your joints? 3. Supporting blood sugar and weight control. Did you know that joint pain in older adults is not only caused by aging or natural degeneration, but is also deeply affected by 2 often overlooked factors: unstable blood sugar levels and excess weight? Many seniors who suffer from arthritis, osteoarthritis, or weak joints may never realize that managing blood sugar and maintaining a healthy weight could help reduce pain, lighten the body, and improve mobility. And this is one of the reasons why guava leaf tea is particularly useful. Studies have shown that guava leaves contain a significant amount of compounds called tannins and flavonoids, which can reduce the absorption of sugar in the intestines. This helps stabilize blood sugar levels after meals. A study from the Japanese Institute for Preventive Medicine found that drinking guava leaf tea before or after meals can significantly lower blood sugar in patients with type 2 diabetes. Why is this important for joint health? When blood sugar levels are high, they can trigger widespread inflammation throughout the body, making the tissues around the joints more vulnerable to damage. High blood sugar over time also weakens the capillaries, the tiny blood vessels responsible for nourishing cartilage and muscle tissue. When nutrition to the joints is reduced, cartilage wears out faster, muscles weaken, and the sensation of pain increases. What about weight? Every kilogram of excess body weight adds stress to the knees, hips, and spine. For older adults, losing even just 3 to 5% of body weight can significantly reduce joint pain. And when you drink guava leaf tea correctly without sugar, and as a substitute for sugary beverages, you help reduce food cravings, control hunger, and maintain a more stable weight. In reality, many people who consistently drink guava leaf tea each day, combined with a diet low in refined carbs and rich in vegetables, have reported not only weight loss but also being able to climb stairs, walk, or stand up and sit down without the pain they used to feel. It is a small step that brings big changes to one's quality of life. Of course, to achieve these effects, you need to use it consistently over time and not expect immediate results. And if you are taking medication for diabetes, be sure to consult your doctor first to ensure that guava leaf tea will not interfere with your treatment. So, with just a simple type of leaf, guava leaf tea shows a wide range of support for joints, from reducing inflammation and protecting tissues to managing indirect risk factors such as blood sugar and body weight. But is drinking more always better? In the next section, we will explore some lesser-known drawbacks of this tea and how to use it in the safest way possible. Precautions when using guava leaf tea. 1. May cause constipation if consumed excessively. Although guava leaf tea brings many benefits to older adults, improper use can lead to unwanted side effects. One of the most common problems that people encounter when drinking guava leaf tea regularly and in large quantities is constipation. The cause lies in the natural tannin content found in guava leaves. Tannins are a group of compounds that have astringent properties, meaning they can tighten tissue and provide mild antibacterial effects. However, when taken in excess, they can also slow down bowel movements. When the intestines move more slowly, stool stays longer in the colon, absorbs more water, and becomes dry and hard. This leads to difficulty passing stool, abdominal pain, and bloating. For older adults, the digestive system is already less active than that of younger people. If combined with habits like drinking too little water, eating few vegetables, or taking medications for high blood pressure, joint pain, or diabetes, all of which can increase the risk of constipation, the problem may become more serious. Prolonged constipation can interfere with the body's absorption of essential nutrients like calcium, vitamin D, and magnesium, which are crucial for maintaining healthy bones and joints. Therefore, constipation is not only uncomfortable, but also indirectly affects the musculoskeletal system. Because of this, if you intend to use guava leaf tea regularly for joint support, it is best to start with a small amount, for example, just 1 small cup per day. Observe how your body reacts over the first 3 to 5 days. If digestion remains normal, you can continue. But if you experience dry mouth, a hard abdomen, or dry lumpy stools, you should pause or reduce the dosage. In addition, you should prioritize using young or mid-aged guava leaves and limit the use of older leaves, since older leaves tend to have a higher tannin content. When preparing the tea, do not boil it too strongly or let it steep for too long, as overly concentrated tea will contain higher levels of tannins. You should also drink plenty of plain water throughout the day and eat more fiber-rich vegetables to help balance your digestive system. Caring for your joints cannot be separated from digestive health. If your intestines do not function well and cannot absorb important nutrients, then no matter how many joint support supplements you take, the effects may not be as expected. 2. May interfere with calcium and iron absorption. One often overlooked concern when using guava leaf tea daily is its effect on the absorption of essential minerals, especially calcium and iron. These 2 nutrients play extremely important roles for older adults, particularly for those dealing with brittle bones, weak joints, osteoporosis, or anemia. The main reason once again lies in tannins, the natural compounds found abundantly in guava leaves. While tannins are known for their mild anti-inflammatory and astringent properties, clinical nutrition studies have shown that they can bind to minerals like calcium, iron, and zinc in the small intestine. This binding process forms compounds that are difficult for the body to absorb. In other words, even if you eat a balanced diet or take supplements, drinking guava leaf tea at the wrong time could cause your body to absorb less of these nutrients or even fail to absorb them altogether. Calcium is the foundation for strong bones, while iron is essential for blood production and for delivering oxygen to muscles and joint tissues. When calcium is lacking, bones become porous and prone to fractures. When iron is deficient, you may feel fatigued, experience muscle weakness, heaviness in your limbs, and have difficulty moving. Long-term deficiencies can worsen joint pain and muscle weakness, especially for older adults who already have circulation problems or osteoporosis. Some people, unaware of this mechanism, often drink guava leaf tea right after meals or even at the same time as their calcium, iron, or multivitamin supplements. This may seem beneficial, but in fact, it has the opposite effect. Not only does it reduce the effectiveness of supplements, but it also deprives the body of the nutrients it needs to nourish bones and muscles. Therefore, if you are taking calcium or iron supplements, you should drink guava leaf tea at least 1 hour apart from those medications. Ideally, you should drink the tea in the morning or early afternoon, and take supplements separately in the evening or according to your doctor's guidance. This way, you can still benefit from the tea's anti-inflammatory effects without compromising your body's absorption of essential nutrients. In addition, keep an eye out for symptoms of calcium or iron deficiency, such as frequent leg cramps, persistent joint pain, dizziness, fatigue, or pale skin. If you experience any of these signs, it is a good idea to have a blood test and review your tea drinking habits, as you may unknowingly be hindering your own recovery process. 3. Should not be consumed on an empty stomach or together with joint medications. Many people have the habit of drinking guava leaf tea early in the morning, right after waking up, believing it helps with detoxification or digestion. However, for older adults, especially those with stomach issues or who are taking joint medications, this seemingly healthy routine can actually bring several drawbacks. Guava leaves have astringent and mildly bitter properties due to their high tannin content. When consumed on an empty stomach, meaning when the stomach is empty and unprotected, tannins come into direct contact with the stomach lining. This may cause sensations of discomfort, nausea, or irritation in the upper abdomen for those with a history of gastritis or acid reflux. Drinking guava leaf tea on an empty stomach can worsen these conditions. Moreover, guava leaf tea can interact with certain joint medications, especially non-steroidal anti-inflammatory drugs, NSAIDs, calcium supplements, or glucosamine. When consumed too closely in time, the tea can slow down the absorption of these medications or alter the stomach's acidity, making it harder for the medicine to dissolve and be absorbed properly. Many older adults tend to take joint medications in the morning or before meals. If they then drink a hot cup of guava leaf tea shortly after, they may unintentionally reduce the effectiveness of the medication or cause irritation to the digestive lining. Over time, this habit can diminish treatment outcomes and affect mobility, resulting in more joint pain, stiffness, or muscle weakness. The proper method, as recommended by health experts, is to drink guava leaf tea 30 to 60 minutes after meals. When the stomach has started digesting food and is more stable, avoid drinking it immediately before taking medication, especially mineral supplements or anti-inflammatory drugs. If you are taking multiple medications each day, it is helpful to write down your schedule and space them out throughout the day. When in doubt, consult your doctor for specific advice. Always remember that no matter how gentle a beverage may seem, it must be used at the right time, in the right way, and within limits appropriate for your health condition. Guava leaf tea is no exception. Caring for your joints is a long journey, and even small daily habits can make a big difference. Dear friend, through the previous sections, we have explored a comprehensive picture of guava leaf tea, a simple, familiar plant that holds powerful effects on joint health in older adults. As we have seen, when used correctly, guava leaf tea can truly become a reliable companion in the journey to reduce inflammation, relieve joint pain, and protect cartilage tissue. At the same time, it helps regulate blood sugar and control body weight, two indirect but equally important factors in maintaining healthy joints. However, like any natural remedy, guava leaf tea has two sides. Overuse, incorrect timing, or improper combination with medications can lead to constipation, hinder nutrient absorption, and even worse in joint and muscle conditions. Therefore, the key is not simply whether to drink it or not, but whether you understand it clearly and use it wisely. You do not need to change everything at once. Start with small steps such as replacing your sugary morning tea with a gentle cup of guava leaf tea, drinking it at the right time after a meal, and observing how your body responds so you can adjust accordingly. Caring for your joints is not only about medication, it is also about consistency and learning to listen to your body each day. If you found today's sharing helpful, please remember to like and subscribe to this channel so you do not miss upcoming videos on joint health, healthy eating, and tips for graceful aging. And I would love to hear from you. Are you using any herbal teas to support your joints? Is guava leaf tea part of your daily routine? Please leave a comment below and share your health journey with me. Wishing you good health, peace of mind, and strong, pain-free joints. See you again in the next video.